thank you for joining us on this Thursday. Today, Mayor Demings in this press event has some very serious information on COVID-related deaths. The mayor will also provide information on testing sites, our strike teams, eviction diversion, and much more. City of Orlando Mayor Buddy Dyer will discuss all things COVID-19 and additional information as it relates to the aforementioned City of Orlando. Dr. Raul Pino from the Florida Department of Health here in Orange County has information on our testing numbers, including the additional background and aggregate data on deaths as well. And Comptroller Phil Diamond is here today, making a special appearance, and is here to talk about tourist development tax collections. We start with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you all for being here once again today. We have a myriad of information that we want to go over with you, but let me just start by talking a little bit about the reopening of schools. I have 5 grandchildren. 4 of them attend the Orange County Public Schools, and we're looking forward to the day that they can go back to the school, but I may not have the opportunity before Monday. As you all know, that on Monday, the students, some 215,000 of them here in Orange County, will return to school virtually. They will not be going to the brick and mortar schools at this point on Monday, August the 10th. And so in order to make that happen, however, even in a virtual atmosphere, it takes the teachers and the support staff to make that happen. And so let me just say, as a grandparent, as a resident of Orange County, as a product of Orange County Public Schools, thank you to our teachers for what they do to take care of our children every day. I know that there's mixed emotions about the reopening of schools here within the state of Florida, but at some point we know that when it's safe to do so, our children have to get back to school. That is the best learning environment that they can have. But until then, they're going to have to do so virtually. And so with that, I'll kind of move forward and talk about a number of things. We have some challenging numbers that we're going to share with you today concerning the coronavirus deaths in Orange County. I'm sorry to say that we are now at a point where we have 275 individuals who have died as a result of the virus within our community. That is a one-day increase of 25 individuals who have died from COVID-19 since our last news conference this past Monday. There have been a total of 38 since the last news conference. Dr. Pino has said to us that the number of deaths is a lagging indicator of the true impact the virus is having on our community. It was startling to hear him say a week ago that his belief was that at least half or 50% of those who were occupying and ICU beds will likely die. Startling to hear that. But when we talk about the virus, you know, I like to put a real human face on it as we talk about the human experience. And one of our American Sign Language interpreters here, Jill, is with us here today. I asked her if it's okay to say this. But her father, 77 years old, passed a week or so ago. Was in an assisted living facility. He died as a result of the virus. So when I have them stand with me every day to help me communicate to this community, I want to put a face on it. Her father. So I appreciate what they do to come in here every time we do one of these press events and help us share with our community the sad realities about the virus and what it truly means is real. So together, we are going to continue to work to fight against the virus in this community. Orange County now has over 30,000. In fact, the number reported today, 30,776 COVID-19 cases within our community. That is an increase of one day of 346 cases, which was a daily positive rate of 6.4%. Since August the 1st, our positive rate has ranged from 6% to 8.8%. If there's any, I guess, encouraging news here, it would be that since August 1st, each day, the positive rate has been below double digits. It's been in single digits. Arguably, some of the experts say that if you can get to a sustained 5% or lower rate, you have essentially contained the virus within your community. So, to the residents of Orange County, that's where we're trying to get to. We can't get there without the collective help of everyone in our community who believes that we can get to that point. Our Orange County Health Services continues to augment what the state does in the way of testing, and they have continued to test this week at the Econ Soccer Complex. Free testing will continue at the Econ Complex next week from Tuesday through Friday. The site will open from 8 a.m. to about 1 p.m. each day. You can make an online appointment directly at ocfl.net/econsoccer for that location. While registration is closed for tomorrow, if you need to get tested, we have availability. You can stop by the Econ Soccer Complex between 8 a.m. and noon and register on site. It may take a few minutes for you to do so, but if you really desire to be tested tomorrow, we are offering free testing there. Of course, testing will continue at the Orange County Convention Center as well. Our business compliance, our strike teams have now visited just over 600 businesses. Compliance remains at about 77%. And while they have had great cooperation from large and small business owners, beginning next week, the teams will be revisiting the sites where they had compliance issues. We will be continuing to use our strike teams for an indefinite period of time. On Monday morning at 8 a.m., our portal will reopen for applications for CARES Act for small businesses. Home-based businesses with 3 or less employees can now apply for the micro grants. The grants will range from $1,000 to $3,000. Some businesses with less than 100 employees can still qualify for the $10,000 grants. So can those businesses who have received up to $75,000 in paycheck protection loans through the federal government. You can go to ocfl.net/orangecares for more information. The Orange Cares program for individual and family assistance will be following up with individuals who have made application. So if you have not received the email with the status of your application, those emails are continuing to go out. To date, more than $17 million have been provided to families and individuals in need during this pandemic. On Tuesday, I will be recommending that the Board of County Commissioners designate $20 million in CARES Act monies for a COVID-19 eviction diversion program. The program will be designed to assist individuals impacted by the coronavirus who are in imminent danger of being evicted. It will also be designed to assist landlords. So it will assist the individuals and landlords. More details will be shared at the Board of County Commission meeting on Tuesday of next week. And with that, that's my update for now. I'm going to transition it to Mayor Buddy Dyer of the City of Orlando.
Thank you, Mayor Demings, and thank you all of Orlando. The death rate is unsettling, but it's promising to see the overall positivity rate and hospitalizations decline in our community. And it's important to remember it's not happening by chance, it's not happening by accident. It's as a direct result of all of us wearing our mask, all of us social distancing, all of us using good hygiene. It's our best defense against the virus, and that's why we have to continue to remain diligent and take the necessary health and safety precautions every single day. We also continue to look for other ways to help our local businesses during these unprecedented times. So on Monday coming up, the Orlando City Council will vote to extend several programs and opportunities that allow businesses to continue to safely expand their sales and restaurant seating to outdoor parking lots and in public rights-of-way like the city sidewalks. That would have, ended at the end of this month, so we're going to extend it through February 1st. Continue to pilot the Osceola cul-de-sac in downtown, which is operating as an open-air hospitality zone, which allows businesses to operate outdoors with better social distancing, to continue to offer rent abatement as a use for MEBA grant recipients, supporting small businesses in our Paramore neighborhood, offsetting metered parking costs for food truck vendors. As I said, these would have expired on September the 1st, and we're extending them through February the 1st. This extension will also apply to our program that provides free parking downtown, both in our garages and on street, to help residents and visitors patronize our local businesses. We will continue to suspend the need for businesses to obtain any permits related to the exercise of these programs and pay any fees on these programs. In closing, the City of Orlando remains committed to increasing testing, continuing increasing. We will be at First Baptist Church of Orlando on Bruton Boulevard on Wednesday, 9 a.m. to 1 p.m. And you can make a reservation, but there's basically no wait at these testing sites. You can drive up and be in and out in about 10 minutes. So you can make a reservation at orlando.gov/COVID-19. Dr. Pino.
Thank you, Mayor. Before we go into the COVID-19, I want to talk a little bit about our immunization event. We are going to conclude that immunization event on Friday at noon. And next Monday, we will start our regular schedule at our West Central Boulevard office, 832. The number will be continued the same, 47723-5004, again 5004, and only by appointments. It's a very small building. We will not be allowing people without appointment. It's a way that we have also to control social distancing and volume, so appointments are needed. So far, up to yesterday in our immunization, we still have today and tomorrow, we have seen 3,161 children, and we have provided 7,612 immunizations for our kids to go to school. I want to thank our staff from the Florida Department of Health that is working at the West Oak Mall providing these services. With regard to COVID-19, as the mayor mentioned, we have 30,776 cases and an overall percentage positivity rate of 11.6. Our recovery rate as of today is 80%, So it continued to increase. And unfortunately, we have 275 deaths. And our thoughts and prayers are with the family and with you, Jill, as well. For the fatalities, we have received 37 deaths listed since August the 3rd. That was the last time we talked to you. So it's an elevated number, of course. But we also want to let you know that 12 of those 37 deaths have occurred before the 3rd, before our last presentation. And those were since the 3rd, we have 5 on the 3rd, 4 on the 4th, and 3 on the 5th. The age range from 49 to 99 years old. And we have expressed our concern about the elevated number of cases that we have in assisted living facilities. So we continue to watch closely some of the assisted living facilities with high number of cases. And I'm going to give you the top 5, I believe, yes. And the first one is Orlando Rehabilitation Center. Now, I always want to put a caveat that this is an institution that has been designed and established for COVID response, so for isolation and recovery. So some individuals are intentionally placed in that facility as they become positive later from other facilities that have less bed or other conditions. With that in mind, they have 207 cases total, 88 positive stats, 119 residents. 1 resident died from COVID-19, 24 new positives since we talked to you on the 3rd. Abante Orlando has 99 total cases, 41 staff, 53 residents. 7 people have died from COVID-19 in that facility, and there are non-new positive residents since the 3rd. Terra Vista Rehabilitation Center has 87 cases, 41 in the staff, 46 in residents. 2 residents have died, and there are non-new positives in the 3rd, which is good news for those facilities. Ocoee Health Center has a total so far of 85 positive individual, 25 staff, 60 residents. 5 individuals have died from COVID-19. 2 new residents were positive since August the 3rd. And Colonial Lakes Health Care, 75 positive cases, 35 residents, staff, 45 residents. 8 individuals have died, and we have only 1 new positive since August the 3rd. In total, in long-term care facilities so far, we had 45 deaths. In total in Orange County, 275, as we mentioned to you. The proportion from long-term care facilities is 60% of all deaths. I also would like to provide you some data. Right there you have the daily epi curve. So those are the daily number of cases as they come up. And you can clearly see our decline day after day. Next. This is our weekly. I showed you that last week, and we are going to continue to monitor this week by week. And on top of that, you have the positivity rate for that week. Next. This one is the 14-day rolling average positivity rate. And the red line is that rate, average, and how is continue to decline very slowly but surely. Next. This is our hospitalization curve. I have the numbers here a little bit more clearly. So on August the 5th, that is yesterday, we have a total of 412 individuals hospitalized, 89 in ICU beds. just to give you an idea, our highest ICU bed was 104. At this point, we are at 89. Next. This is a new curve. I just got it. I haven't even looked at it in the office. I just got it. What we did here was to overlap the death and the number of cases daily. So in blue, you have the number of cases daily, and in orange, you have the number of deaths daily. And as you can see, and the mayor was mentioning how even when we have so few number of cases in the prior wave, if we want to call it that way, we continue to see death because it lags really. It's a data that lags behind the other indicators. And the same is happening here where we are right now. We have an elevated number of deaths even when the number of cases and the positivity rate continue to decline. And that's something that the public also have to understand. The mayor mentioned to you that we have a positivity rate for yesterday of 6.4. We received 5,074 cases, so we are back to normal volume. Remember that over the weekend, one of the testing sites, the largest testing site, was closed at the convention center. So on the 2 prior days, we did close to 3,000 tests. Yesterday, we did 5,074. That's about a regular number. And 346 of those cases were positive. Do we have another table? No. So I also want to give you people in our community and some of the journalists ask for data on children younger than 18. And I have this data now. These are crew numbers. We haven't gone into analysis yet because we're starting to clean the data, so we are developing frequencies. And soon enough, we will be able to get more into the weeds with regard to the data. And the idea to start seeing is to have a baseline before the schools open, so that when the schools open and the students and the teachers go back to school, we are able to monitor the pandemic within the school system. So we are creating the structure to do that. And I will explain a little bit on this one. Younger than 1 year old, we have 142 cases in children younger than 1. So part of these cases is also that newborns born to positive mothers are tested if the mother is positive. And there's a number of cases in that category. What happened is believed that, I read some papers, it's believed that transplacental transmission can happen as well as transvaginal transmission in the vaginal fluid. It's not clear, it's not definitely an answer, but some babies are born positive to the virus. From 1 to 4, we have 226 cases. From 5 to 10, we have 449 cases. From 11 to 13, we have 287 cases. And from 14 to 17, we have 681. Now, this is since March. So we will continue to monitor this data and start refreshing the data and be more observant of the last 14 days. So when we have the data, we will continue to provide to you as it comes. And I believe I'm passing the microphone to Mr. Field, our controller.
Thank you. Good afternoon, everybody. I'm here to report on the county's tourist tax collections for the month of June. And for the June 2020 collection month, the county's collections were $2,629,400. That is a decrease of 89.2% from June of 2019. On the bright side, while TDT collections remain at historically low levels, TDT collections did increase compared to May 2020 collections. And that increase is at least partially attributable to the reopenings of Universal, SeaWorld, and other attractions, although at limited capacities. Looking forward to July's collections, there are some more hopeful signs. Disney World reopened all 4 of its major theme parks in July, again at limited capacities. And Disney also hosted and is still hosting the National Basketball Association and Major League Soccer. The Convention Center hosted the AAU Junior National Volleyball Championship, and it was reported that the July 4th holiday weekend was a busy one for Central Florida, so that bodes well. However, that information needs to be tempered with the reality that the number of new Central Florida COVID cases in June and July spiked at high levels, along with the announcements that one major theme park was reducing its workforce, and another major theme park is delaying the reopening of some of its hotels and resorts. Clearly, the pandemic continues to weigh heavily on the tourism industry. However, everything that has made Central Florida the country's most popular destination before the pandemic will still be here after the COVID-19 pandemic passes. We're home to the world's best theme parks and entertainment. We have world-class hotels and resorts. Our convention center is the 2nd largest in the country, and we have great weather. This all bodes well for our long-term outlook. However, nobody knows how long it will take to recover. So while the county is fortunate to have healthy reserves that can be used over the short term to meet its funding obligations, it is very important to continue to analyze ways to minimize the drawdown of reserves. Given that the length of time for the tourism industry to recover is known, we are starting this month including a tourist development tax summary in our press releases to provide additional information to help monitor TDT trends and reserve levels. And by way of example, the chart in the press release that we're releasing this month shows a $17 million drawdown on reserves. We will release, in the first week of September, we will release the July 2020 TDT information for the public. Thank you.
Okay, you heard a lot this afternoon. Let me just say this in terms of our tourism-based economy. Just think about where we would be in terms of our economic impact without it. Those communities that do not have these themed attractions in their localities, they're struggling even more than what we are. So while the numbers are down, I do join the controller in acknowledging that the June numbers that you just heard, they were better than May. And so as we endeavor to try to reignite our local economy, we still have a lot of work to do in that regard as we look to diversify our economy, but also take care of the economy that we have. You know, we have seen a multi-billion-dollar negative impact on our local economy. And so that means that not just the business community, but those of us in the public sector, the government, we have to look for ways to be able to restructure, reallocate funding, and leverage what we do have in the most efficient way that we can. So I look forward to working with the controller and my fiscal staff on ways that we can further cut costs here within Orange County itself. But, okay, with that, we'll open it up for any questions. And just as a reminder, if you are Spanish-speaking media and you have questions in Spanish, I will ask Ms. Ilia Torres, one of my special assistants, to come forward and translate on my behalf if it's in Spanish, and Dr. Pino certainly is fluent in Spanish. And then we have two of our county commissioners who are here, Commissioner Uribe and Commissioner Maribel Gomez Cordero are both here, and they certainly would be of assistance as well. So with that, we'll open it up for questions.
Lauren Seabrook, Channel 9. Mayor, I have two questions, short ones, one for Dr. Pino and one for Mayor Dyer. Do you want Mayor Dyer to go first? Okay. Just before the press conference, you had tweeted a clarification to some of your comments about the bars reopening, and I just wanted to see if you could maybe tell us specifically what ideas you or the city have to help some of these bars reopen safely.
So I was on Good Morning America the other day, and I inartfully tried to convey empathy for the bar owners because they're businesses that are in probably some of the most difficult circumstances. They're under a state order that, number one, doesn't allow them to be open. They don't know when that order will be lifted and what restrictions will be in place when they reopen. So I would ask them to start putting together plans on what steps you need to take to successfully reopen. So to be clear, I would support the reopening of bars when we can do it safely and they can operate safely. We don't control when they're going to open. The county doesn't control when they're going to open. I know that the Secretary of DPR has been meeting with some bar owners around the state. He hasn't been to Orlando to my knowledge, but I would encourage our bar owners here to talk with our Downtown Development Board and maybe put together some thoughts that we can convey to DPPR. Thanks.
And Dr. Pino, if you could just tell us if you have any knowledge of any kind of symptoms that these children under 18 have had. I know that's been the biggest question in the past, especially with the little bitty ones. Do you know if any of these kids have symptoms, or does it seem they're mostly asymptomatic?
Yeah, we will be able to know. I don't know it yet, but if you keep asking that question, it will come. So what have to happen, so people understand, we have a data file that has 30,000 people this way and probably 30, 40 variables this way. When you multiply those 4, 5, 20 for 30,000, that's the number of data points that you get. So what we try to do in this case, for example, is to separate the kids younger than 18 out of that database, move into another database, clean the database, design the analytics, and then you will run it. After they are designed out of the hour, you can just run it with a click. But it takes time to design, to clean, and then every day you have to do the same with the number of cases that are coming. So that's the process that we are doing now. We can run some frequencies because they're only based on this level of data, not in this other level of data where you need it cleaning. A dot, a comma, a number where it's not supposed to be can upset the data set. So that's what yes, we will be able to do that. But most children are asymptomatic.
Steve Hudak from the Sentinel. I have two quick questions, one for Dr. Pino, one for Phil Diamond. Dr. Pino, what would you tell the bar owners about what they should be thinking about in terms of reopening? What kind of things should they have in place?
I thought you were my friend. So the issue with the bars is not that they sell alcohol itself. It's not the bar. It's that normally bars are designed to be small because you want that feeling of being close to people and being in a party environment. That's what the bars looks for. And even if you think when we were doing bar hopping our ages, if you see a bar that is empty, you may not even go, oh, that's not good. If you see a bar that is crowded, say, oh, something good is happening there. And that's where you tend to be. And the issue is the space, the limited amount of space. And if they operate at a lower rate and percentage, it will not be economically feasible because you need that volume to be able to pay the staff and to pay your rent. So they are in a pickle. That is the reality. They, better than anyone, will have come up with proper ideas, what can be done. The mayors have talked about expanding into the outside space if those are open and doesn't infringe any laws or right-of-ways. Decreasing the number of clients that they serve at one time. Maybe opening longer hours so that people have more time to go and not crowded. Although people tend to go to the bars between 10 o'clock and 1 o'clock in the morning. And also when people get a little bit of alcohol in the system, alcohol is known to impair judgment. And wearing a mask, self-distancing, washing your hands, those are judgment calls. I do sympathize with what they are experiencing, and I hope that we can come all together with ideas so that even a limited capacity, they can open and still, generate some revenue.
We're still pals. Mr. Diamond, how long can we continue to draw down on our reserves?
It really depends on what happens with tourism. If the numbers are 2 million, 3 million, 4 million a month, that's not sustainable. But if and when the numbers get higher, then that would be sustainable. I mean, we survived for a long time on the collections that we had because they were strong and because they were more than enough to cover whatever needed to be covered. Hopefully July is a better month than June, just like May was a better month than April, and April was April. But it really depends, and I think that depends on a lot of things. I mean, you get some seasonality with tourism. I mean, September, unfortunately, is typically a slow month because kids are back in school. Other months are really strong. March is typically a really good month. It wasn't this year because of COVID, but typically it's been a very good month. So it really depends, Steve, and it depends on collections, and that's something that right now I don't know that any of us really know.
Kelsey Thord with West 2 News. My question is for Mayor Demings. You spoke at the beginning of this. You talked about schools reopening, and you thanked teachers for all of their hard work, and you said, that you have grandkids that are in the school system. And you said that you don't think schools should reopen until it's safe. Do you think it's safe for schools to reopen August 21st when they're slated to?
I think our local school district has wrestled with that with an abundance of input from our healthcare experts, and they've made a decision that the safest way to return our students to school is to do that virtually. So I believe that given where we are now, that was an appropriate call on their part. At some point, that will perhaps change. Again, we endeavor to drive these numbers down, and I hope that we can get those numbers for a sustained period of time in that 5% or less range. Each week we see encouraging numbers coming out so far, and so we'll just have to see. I know that in terms of the in-person learning, that is slated to, I believe the date is August the 21st, I believe is the date that they're planning to do that. So that's a couple of weeks from now, and we'll just have to see, but obviously when we make decisions, it's based on the most accurate data that we have at that time.
Hey, Eric Mock, Spectrum News 13. Question for Phil Diamond again. So can you repeat again how much the, I know you said it's 89.2%, but how much the dollar amount was compared to last year? And also, I know you said it depends to the question of, how long can we live off our reserves, but I mean, how much is in reserve? I know you said we've drawn down 17 million so far. How much is left in that fund then?
Well, and that's a good question. That's why we're including the reserve number, because for the past couple of months, people have been asking about. I thought Steve was going to ask me about that, and but that's why we're including that. And there are certain expenses that the county has that are fixed. We have bonds on the convention center that you have to pay, and that's not going to change. That amount's not going to get bigger. It's not going to get smaller. It is what it is. It's about $80 million a year right there. And as far as everything else that is paid for, it just depends on the expense and what it is. And what kind of contracts and what kind of obligations have been made. And so it's hard to say specifically without looking at each one. As far as the revenues, on the revenue side, it was $2.6 million, and that was an 89% decrease from last year.
This next question was texted in for you, Dr. Pino, from Naseem Miller in the Orlando Sentinel. She writes in, looking at the current numbers, would you say that we're at a plateau, or are there clear signs of a decline in the spread of the virus in the community? Also, how do you think school reopenings could affect the current trend?
So with regard to the positivity rate, that is clearly in a decline. With regards to the number of deaths, we are about to plateau. Although we have seen some decrease in the daily rate in some areas. And in general, I will say in the pandemic in general, we continue to be in a positive direction. How will the schools, opening the schools will affect the pandemic? I think it depends a lot in the number of children that goes to the school. We are hopeful that many of the parents will select and have the ability to have the school in distant learning, so that those that really need to be physically present can be and have the safe environment that they need, as well as the teachers. So we will know later when they have the final numbers of who is doing remotely and who is doing in classrooms. And we are currently reviewing some of the proposals from the board. Our epidemiologists are deep into it. So we are in the process.
Thank you. These last two are for you, Mayor Demings. The first one comes from Ryan Lynch with the Orlando Business Journal. Mayor Demings, would the county consider adding any other programs or policies in conjunction with the eviction diversion program?
We have a plan that we'll present to the Board of County Commission on Tuesday, and the board may tweak the plan, so we'll have to wait until after Tuesday.
And this
Ryan is like clockwork. He always, I know he's going to ask these questions at the end,
And from Amy Green here from WMFE, Mayor Demings, can you clarify your comments on schools? When you say we'll have to see, does he mean it's possible schools won't open August 21st? Would the county require a 5% positivity rate to reopen?
Unfortunately, the authority to open the schools and the directive that came out emanated from the governor through the Commissioner of Education for Florida, and it diminished the local counties, communities' authority to make any decision in that regard. But here we have an elected school board, a body that is entrusted with making the decisions about the education of our students, our children through the public school system. And so it rests with them. So is it possible? It's possible, but I think that the school district has the burden in this case of understanding what the data says by which to make some decisions or make appeals to the governor to change the directives that have been put out.
And a late entry here for Phil Diamond. Jason Garcia with the Orlando Sentinel asks, Comptroller Diamond, do you believe Orange County should continue using reserves to fund the design of the convention center expansion?
Well, first of all, I think you need to look at what's going on with the tourist tax right now, which is, and I didn't fully answer the previous question. You had asked how much was it last year, and it was $24 million. And this year it's about $2.5 million. So that's about a $22 million difference in what we collected this year in June versus what we collected last year in June. And that's a lot of money. And I think, like I said, that's obviously not sustainable. And as far as what it ought to be used for, I don't typically get into that because I think that's a matter of policy as far as what the tourism tax ought to be used for. And the Board of County Commissioners makes policy decisions. We're focused more on the numbers in my office as far as what's sustainable, what's not sustainable. And when you look at the $17 million that was spent last month, that was taken from the surplus funds, a good amount of that was for the convention center, some of it for operations, some of it for construction projects. And I think when you look going forward, that's a lot of money. And I don't know whether things are going to stay in the $2 million, $3 million, $4 million range, or if we're going to get back to the 10, 15, $20 million range, $25 million range, like it was this year up until March came along. So I think as far as what you spend it on probably isn't as important as how much you're spending. And like any family or any organization, any government, I think you have to look at what your inflow is, what your outflow is, and then decide how do you extend as long as possible when you're in a situation where you're using your savings to meet your monthly expenses. So as far as any particular item, I think it really comes down to all items, and all items need to be looked at for sure.
I guess I can jump in on that one. I'm the mayor of Orange County, and by that, the executive for the county and the chair of the board. We make our decisions based upon the facts and what we see happening at the time. And obviously, it's not sustainable for us to continue spending as if nothing had happened. You know, when we started this process of living with the pandemic, probably none of us thought that we would be continuing to live with it in August, you know, going back to March. But the fact of the matter, it is still here. And it is unknown how much longer we will have to continue living with it. But suffice it to say that I do believe that our revenues are likely going to continue to be down. And that means that Orange County, the Board of County Commission, is going to have to make some adjustments in how we spend the funds that we do have. My best guesstimate is that this is a phenomenon that we're going to be dealing with through, at the very least, the end of this calendar year. So that means that that will run us into a new fiscal year as well. Our fiscal year will begin October 1. And so without question, the Board of County Commission is going to have to make some public policy decisions that are going to be tough decisions. We're going to have to cut some spending. There's no question about it. So where we cut, we will wrestle with those issues with the Board of County Commission. Two of my colleagues are here, and you know, there's only so much we can talk about at this point in an unadvertised meeting. But suffice it to say that I'm saying to you, as the mayor of Orange County, there's no question we'll have to cut. So, okay. Are there other questions? All right. Again, join me in giving Jill a hug over here, you know, with the passing of her father. You know, our prayers certainly go out to her entire family and all those other families that have lost a loved one who have been directly impacted by this virus. Thank you for joining us today.